The type of eye condition I have is called Fuch's dystrophy. And it's a typically a genetic disease. With Fuch's dystrophy, it's a very slow process. So your eyesight starts deteriorating, but you kind of don't even realize it's doing it. It's a very, very slow kind of diminishing of what I want to say, detail. You wake up in the morning and it's like, why is everything kind of cloudy? And they tell you to actually use a blow dryer on your eyes a few times, and it will help dry up your eyes to kind of take away that cloudiness. And it does work. And what was interesting in my case was, even though I have the disease in both eyes, my right eye was progressing a lot quicker. And as it progressed quicker, the fogginess would not dissipate through the day. Usually with my left eye, which has the disease, it's kind of foggy in the morning, but after an hour or so of being up, it kind of dissipates and you're like, oh, okay, everything's clear. With my right eye, it didn't do that. It just kept progressively just staying foggy and to the point where nothing was going to clear the vision unless I had the transplant. My lifestyle did change with my eye disease. I think for me, it was being more aware of that when I'm driving, I need to turn on a street. Well, I couldn't see the street sign until I got on top of it, and as I drove past it, turn around, and go on. So it wasn't that I was a hazard to myself or anyone else on the road. The clarity was lessening, and usually at night, I wouldn't drive much at night, especially in the rain. So, the disease, by the time I got to the point where I needed the transplant, it was definitely being affected, affecting my freedoms in some way, because I wouldn't choose to get in the car and drive at night. When I was first diagnosed with Fuch's dystrophy, I knew at some point I was going to have the cornea transplant. Was it going to be next week, next year, or 7 years down the road? That was to be determined. So as I went to Asheville Eye Associates and saw Dr. Macaluso year after year, we kept looking at both my eyes and realizing the right was deteriorating quicker. Surgery was not a difficult procedure at all. It was quite fascinating, in fact. Then I laid on my back for 24 hours. That's the hardest part of this surgery, is after you get done. After you lay on your back for 24 hours, went back and saw the doctor. Everything was looking good. That was on a Monday. By Friday, I was driving. It was great. No problems. Let's see, after I got the transplant, at the beginning, you're very careful because you have stitches in your eye and you don't want to rub your eye anymore. That's the hardest thing about a new cornea. You can't rub that eye anymore like you like to. But as the days and weeks and months have gone on now, it's been about 7 months since I've had my transplant, my life has gotten better in the fact that I can see clearer. Color's back, detail of things are back, and that's what's nice. I mean, is it 100%? No, but wow, it's 100% from what it was before I had the transplant. So it was just wonderful knowing that, here I have a cornea donated from someone, and it's allowing me to see the way I used to be able to see, and that is huge. So for me, it's been like 100% clearer vision. I don't pass street signs anymore. Oh, there it is, I need to turn here. It's been great. I just can't imagine not having this done. Can't imagine.